cell. Okay, so for this part of urinalysis, we'll be talking about microscopic examination. So let's start first with the blood cells present in the urine sediment. So first we have the RBCs or red blood cells. So RBCs, of course, are smooth, non-nucleated biconcave disc, usually ranging from 6 to 8 micrometer in diameter. So usually the presence of red blood cells in the urine must be noted because, of course, they are clinically significant. But they're also present in little amounts or little concentration, in little number in normal condition. So provided that that their number will range from 0 to 2 or 0 to 3 only. Okay, so greater than that will indicate glomerular or kidney pathology. So what are the other forms of RBCs that can be observed in the urine? So RBCs in hyperstenuric urine or specimens having high specific gravity or they're concentrated. So RBCs may appear crenated. So if you're trying to remember earlier, this is the reason why in the blood reagent strip, pwede ka maka-encounter ng false negative reaction. Okay, because in concentrated urine, okay, the RBCs tend to be crenated. And if they are crenated, they are more resistant to lysis. Okay, so as they come in contact with the blood reagent strip, okay, they will fail to lyse, okay, causing a false negative blood reaction. Next form of RBC we must take note of are RBCs naman in hypostenuric urine. Okay, so RBCs in hypostenuric urine or low specific gravity, okay, the RBCs here may lyse. Okay, so RBCs here in hypostenuric urine are what we call as ghost cells. Okay, so ito naman yung reason, okay, kung bakit yung na-encounter nating question earlier, okay, in which there is a positive blood reagent strip, but there are no RBCs seen on the microscopic examination. Okay, ito yung reason. Okay, because the RBCs will lie in specimens that are dilute, hypostenuric, or diluted. Okay, so usually the medical technologist or the laboratorian will usually miss these cells because if not examined in reduced lighting. Okay, so in this illustration, the ghost cells or the RBCs, the lyse RBCs here are actually this. Okay, so kapag hindi masyadong tinignan ni medtech, okay, hindi niya tinignan in reduced lighting, okay, the medical technologist may miss these RBCs. So again, these are RBCs or what we call as ghost cells. Next, we have dysmorphic RBCs. Out of all the forms of RBCs, this is the most clinically significant because once you see this dysmorphic RBCs in the urine specimen, it indicates glomerular damage or bleeding. Okay, so once na nakita mo yan, automatic pathogenic agad. Okay, pathogenic agad or may pathologic condition going on with the patient. Okay, so dysmorphic RBCs again as compared with the lyse RBCs or the ghost cells, the RBCs here tend to be fragmented. Okay, much smaller in size as well as it is more fragmented. Next, of all the sediments in the urine, okay, RBCs is the most difficult to recognize because RBCs may have different morphological variations as well as marami rin siyang kamukhang mga sediments. So these are the sediments that may resemble RBC. So here, first example is the yeast cells. Okay, so it may resemble RBC, but take note here for yeast cells, you can differentiate from RBC, okay, by looking at the budding. Okay, budding present in the yeast cells. So that's one way to differentiate from RBCs. Next, we have oil droplets. So it may resemble RBCs, oil droplets, but how can you differentiate it from the red blood cells? So in here, for oil droplets, it is highly refractive as compared with RBCs, as well as it has perfect round shape as compared with RBCs. Okay, it is highly refractive as compared with RBCs, as well as it is more round in shape. Next, we have air bubble. So it may also look like an RBC, but take note that usually when you notice these air bubbles, so you cannot focus any sediments apart from it. Okay, so ito lang yung nakikita mo from the field. Okay, the rest, okay, wala kang makikitang mga sediments, so mga malabo. Okay, so tendency, yung RBC look-alike na makita mo is most probably air bubble. So aside from that, of what I've said earlier, uh, you can also differentiate RBCs from these RBC-like sediments by, sorry. Okay, so you can differentiate the RBCs from these RBC-like sediments by uh, uh, putting a 1 drop of acetic acid in the specimen or in the slide. Okay, so the positive result, okay, in order for you, if you want to suspect the presence of RBCs, after addition of acetic acid, dapat maglalise or magdi-disappear yung suspected cell mo. Okay, so after addition of acetic acid, dapat again maglalise yon. Okay, if it is truly RBC. So kapag hindi siya naglise, it's either yeast cell na siya, all droplets, or air bubbles. Next cell we have the white blood cell. So it is larger than RBC. So WBCs rapidly lyse in dilute alkaline urine. So again, it is the reason naman earlier question natin kung bakit negative yung nitrite, positive sa LE, but no WBCs are seen in the microscopic examination. So again, just like with RBCs, WBCs tend to lyse in dilute alkaline urine. Okay, so uh, on the third slide of the first video, we talk about the changes in unpreserved urine. So again, if the specimen is left at prolonged standing or left at room temperature, so sediments like RBC, WBC, and CAS may disintegrate or may lyse, okay, in the presence of dilute or alkaline urine. Okay, so what is the clinical significance of white blood cells in the urine? Okay. So it may indicate, of course, urinary tract infection, yung primary purpose niya. So urinary tract infection, lower UTI or cystitis, upper UTI or pyelonephritis, okay, or interstitial nephritis. But take note for interstitial nephritis, there is a present WBC, but take note without bacteria. So dapat walang bacteria. And additional, okay, dapat then you can also notice, okay, may presence ng eosinophil. So how will you detect the presence of eosinophil? By using a specialized stain. Okay, that stain is called Hansel stain. Okay, so Hansel stain is the urinary stain for eosinophil. Okay, so this is an eosinophil with Hansel stain. Okay, notice the red granulation. Okay, so indicative or significant of eosinophil. Next, we have another form of WBCs. So WBCs in hypostenuric urine or urine specimens having low specific gravity may exhibit this sparkling morphology or appearance. So this form of white blood cells is called glitter cells. So they seem to glitter in appearance due to the Brownian movement. Okay, so again, WBCs in hypostenuric urine or low SG urine, okay, may resemble glitter cells. For RBCs, earlier, RBCs in hypostenuric urine, of course, may have a ghost cell, okay, appearance. So again, this is eosinophils and Hansel stain. Next, we now move on to the epithelial cells in the urine sediment. So it is the most abundant epithelial cell on the urine sediment as well as the largest cell, okay, present in the urine. Okay, so it is again a largest cell in the sediment with abundant irregular cytoplasm and prominent nuclei. So it usually squamous epithelial cells or epithelial cells originate in the lower urinary tract or lower urinary tract, specifically in the urethra. Okay, so once found in the urine, okay, it has no pathological significance. Okay, so main use niya for the laboratories actually, it is a good reference for you to focus. Okay, so kapag nakita ka na yan, then na-focus mo na yung microscope mo or yung specimen mo. Okay, so one form of epithelial cell that has a pathologic significance is yung clue cells. Okay, so kapag nakita ka ng clue cells, okay, epithelial cells na may mga naka-attach na organisms, okay, that's clue cells. So it is of course pathologic, so associated with Gardnerella vaginalis infection. Okay, so if you try to remember, Gardnerella vaginalis infection causes, of course, bacterial vaginosis. Okay, next we have another type of epithelial cell, transitional epithelial cells or urothelial cells. So these are smaller cells as compared with squamous epithelial cell. So they may appear in several forms. It can either be spherical, polyhedral, and caudate. Okay, so one one way for you to differentiate transitional epithelial cells from the next epithelial cell that we will be discussing, which is the renal tubular epithelial cell, okay, is the presence of the nucleus. Okay, so in here the nucleus is round, okay, but positioned at the central part, okay, of the epithelial cell. Okay, so the significance of transition epithelial cells is seldom significant. Okay, it only significance the normal sloughing of the cells, okay, of the uh, urothelium. Okay, so the transitional epithelial cell that exhibit abnormal nuclei and vacuoles, okay, may indicate viral or malignant condition. So take note, although they are seldom clinically significant, if the transitional epithelial cell that you've observed has an abnormal nuclei as well as vacuolation, they may indicate viral or malignant condition and must be noted and uh, reviewed by a pathologist. Next epithelial cell, we have the renal tubular epithelial cell. So just from the name itself, it is derived from the renal or kidney tubules. So it means once you've seen this in the uh, once you've seen this in a specimen, so it may indicate kidney injury or tubular injury. So it varies in size. So again, how will you differentiate it from the previous cell, which is the transitional epithelial cells, because they may have a similar morphology. So so how will you differentiate them? So RTE cells have eccentric, okay, still they have round nucleus, but the nucleus is placed eccentrically, okay, on the cytoplasm. Okay, so eccentric meaning, okay, on the side or nasa gilid. Okay, so again, once I've said, as I've said a while ago, RTE cells once seen in the urine is, of course, clinically significant. So the presence of greater than 2 RTE cells per HPF indicates tubular injury. So most of the time, you can see RTE cells in conditions, or in a condition, acute tubular necrosis. Okay. Okay. So acute tubular necrosis has a variety of causes. Okay, it may include chemical toxicity, drug toxicity, or viral infection. Okay, but most of the time, it is usually caused by hemoglobin or myoglobin toxicity. Okay, so kung baka nagkakaroon ng hemoglobin or myoglobin toxicity. So it is preceded by, of course, hemolytic crisis or crush injuries. Okay, so if you develop hemolytic episodes of hemolytic anemia or crush injuries, you may have a chance, okay, to develop acute tubular necrosis because hemoglobin and myoglobin are toxic to the kidney tubules. So now we move forward to the RTE-derived cells, or the cells, okay, that are RTE, one of the forms of RTE. Okay, so first we have oval fat bodies. So oval fat bodies are renal tubular epithelial cells that absorb lipids in the glomerular filtrate. Okay, so RT cells are again in the kidney tubules. Okay, usually sila yung nag-reabsorb ng mga nag-pass dun sa glomerulus. So again, RTE cells here that absorb lipids in the glomerular filtrate. So saan mo nakikita, or what conditions will you see oval fat bodies in this urine? Okay, so it is associated with lipiduria, okay, specifically in nephrotic syndrome. So nephrotic syndrome, okay, heads up ko lang, okay, nephrotic syndrome isn't a single disease. Okay, nephrotic syndrome is a collection of symptoms. Okay, it is a collection of symptoms in which the patient is characterized as having striking or marked proteinuria as well as hyperlipidemia. Okay, so under nephrotic syndrome, may iba't ibang mga sakit under it, okay, such as focal segmental glomerulosclerosis, minimal change disease, okay, etc. Okay, so lahat ng mga to, yung mga nabanggit ko, are all considered nephrotic syndrome because they may cause the patient to excrete abnormal amounts of protein as well as elevate lipids in the systemic circulation. Next, we have bubble cell. Okay, so bubble cells naman. Okay, so this is an example of oval fat bodies. Okay, so how will you before going to bubble cells? So how will you confirm the presence of a oval fat body? By performing fat staining or polarizing microscopy. So Sudan staining is made for you to detect kung may present na triglycerides or neutral fats sa oval fat body. Okay? Yung polarizing microscopy naman is made for you to detect if may laman na cholesterol naman in the oval fat bodies or yun sa RTE cell. Okay, so again, si cholesterol kasi hindi siya na-sustain ng mga fat stain. Okay, such as Sudan 3 or oil red O. So it is usually visualized by means of a polarizing microscopy. Okay, so next we have yung bubble cell. So bubble cells are renal tubular epithelial cell with non-lipid vacuole. So sa anong mga condition may present si bubble cell? Okay, so si bubble cell present in acute tubular necrosis. Okay, acute tubular necrosis. Next we have the miscellaneous urine sediment. Now let's start with bacteria. Of course, bacteria, it is significant for the detection or diagnosis of UTI. In conjunction with the positive chemical test for nitrite as well as leukocyte esterase, as well as it may also signify if the specimen is improperly collected or unpreserved specimen. So this is unpreserved, no, not preserved. Okay, unpreserved to, unpreserved. Okay, okay, unpreserved specimen. How about for yeast? So the clinical significance of yeast usually due to vaginal or fecal contamination, but may be due to kidney infection, often in urine of the diabetic. So usually, aside from positive glucose ketones, okay, manonotice mo sa urine ng mga diabetic is that may presence ng yeast cell. Next, we have trichomonas, the most common parasitic infection. Okay, parasite seen in or encountered in urine specimen. So again, parasitic infection of genital tract, more common in females. So how will you confirm the presence of trichomonas in the urine specimen? Of course, you need to observe the motility. So again, the motility of trichomonas is jerky. Okay, so jerky motility. So ano naman yung pwedeng relation niya with chemical test? For trichomonas, positive sa LE. Okay, positive sa leukocyte esterase. Next, we have for sperm, usually not significant in adult. Okay, huwag nyo na pagpiestahan yung mga specimen na may sperm. Okay po. Okay, so, but take note that it may be a sign of sexual abuse in child. So, kapag nakita sa batang patient. Okay. Next, we have yung mucus. So, mucus threads or mucus, it is not clinically significant, but I just want you to take note that the major constituent of mucus, okay, as well as casts, okay, that will be discussed earlier is uromodulin. Okay, so if you remember, uromodulin is the major protein found in the urine. Okay, it is a protein unique to the kidneys. Okay, so uromodulin again is produced by the renal tubular epithelial cells in the distal convoluted tubule. Okay, so again, no clinical significance, but may be mistaken for hyaline casts. Next, we now move on to the casts. So casts are the only elements found in the urinary sediment that are unique to the kidney. So why are they unique to the kidney? Because one of the major constituent of casts is again uromodulin. Okay, so uromodulin again is the protein unique to the kidney. Okay, again it is produced by the renal tubular epithelial cell in the distal convoluted tubule. So again, uromodulin. So with that said, casts are formed at distal convoluted tubule, and aside from that, it is also produced at the upper portions of the collecting duct. So how will you examine for the presence of casts? So before examination, so you must make sure that yung lighting mo under reduced lighting. Okay, kasi yung mga cast na to, they have low refractive index. In order for you to better visualize them, you need to reduce your lighting by adjusting your rheostat. Okay, so next, in order for you to visualize cast, okay, you must use low power objective of course. Okay, preliminary screening. But if you want to identify kung ano mismo yung cast na yon, okay, saka ka pa lang mag HPO. Okay, so next, If you use the cover slip method for reading microscopy examination, take note that if you want to examine for the presence of cast, okay, you should scan along the edges of the cover slip. Okay? So kapag di ka na gumagamit ng cover slip, okay, kahit hindi na, okay, along the edges. Okay? So let's start with first cast, hyaline cast. So hyaline cast is the most frequently seen cast in the urine specimen. So it consists almost entirely by uromodulin. Okay, so usually, since it consists entirely of uromodulin, so ibig sabihin, okay, walang clinical significance. Okay, walang clinical significance. So, can be found in normal conditions, in strenuous exercise, dehydration, heat exposure, and emotional stress. Okay? So, same refractive index as urine may be overlooked with bright light. So, again, for CAS, dapat examine yan under reduced lighting. So, take note, even though it has no clinical significance, take note that you can also see this in a variety of pathologic conditions. Okay? So, isa doon, of course, si congenital heart disease. Okay. Congestive heart failure. Okay, congestive heart failure. Next, we now move on to RBC casts. So RBC casts, just like the presence of dysmorphic RBCs, may indicate glomerular damage. So RBC casts are associated with dysmorphic RBCs and proteinuria. So take note, dysmorphic RBCs, proteinuria, and RBC cast, okay, may indicate glomerulonephritis. Okay, glomerulonephritis. But RBC cast can also be found in normal persons following strenuous contact sports. So strenuous exercise din, associated din siya. So ano ba yung mga cast that may be present in strenuous exercise? Okay? So or in what we call as the athletic pseudonephritis. Okay? So ano ba yung mga cast na present nun? So kakabanggit lang natin kanina, hyaline, RBC cast, pwedeng RBC cast, and granular cast. Okay? So granular cast, RBC cast, and hyaline cast. So those casts can be seen following strenuous exercise. Okay. Next. So aside from yung RBC cast, so a specialized form of RBC cast, okay, present in massive hemoglobinuria or myoglobinuria, okay, or what we call as granular dirty brown cast. So itong granular dirty brown cast, okay, pathognomonic for acute tubular necrosis. So ano na yung mga dapat nyo tandaan for acute tubular necrosis? We have granular dirty brown cast, okay, yung kanina, okay, yung bubble cells, okay, as well as yung, of course, greater than 2 RTE cells per high power field. So yun, may indicate tubular injury. Uh, Sorry. So aside from that, aside from sa mga nabanggit ko, one clue din para malaman mo na may acute tubular necrosis is of course, okay, yung characteristic odorless urine. Okay? Odorless urine. For odorless urine, may indicate acute tubular necrosis. Okay, next we have WBC cast. So again, just like WBCs, the presence of WBC cast indicates infection or inflammation within the nephron. Okay, so WBC cast is most useful for distinguishing or the differentiation of upper, okay, and lower UTI. So for upper UTI or pyelonephritis, okay, may presence ng cast. So bakit? So pyelonephritis is a tubular or interstitial disorder. Okay, yung mga tubular interstitial disorder, usually sila yung mga conditions na may presence ng casts. Okay? Presence ng cast or may mga increased protein. Okay? Increased secretion ng uromodulin. Okay? Mga tubular or interstitial conditions. How about for cystitis or lower UTI? So take note, in cystitis or lower UTI, walang cast. So cystitis naman, infection of the bladder, okay, renal bladder. So cystitis, infection of the renal bladder. Hindi siya infection of the cyst, okay? Infection of the renal bladder. So ano na yung mga dapat nyo i-take note with pyelonephritis? Okay, so kanina yung mga nabanggit, WBC, okay, and WBC cast, as well, of course, presence of bacteria. For cystitis, presence naman ng bacteria, okay, presence ng WBC, but take note, walang cast dapat, okay, dapat walang cast. Next, WBC cast can also be present in interstitial nephritis or acute interstitial nephritis. So again, nabanggit ko kanina, in acute interstitial nephritis, may presence ng WBC, WBC cast but walang bacteria. Okay, kaya nga sinasabi nila, in interstitial nephritis, it is characterized as having sterile pyuria. Okay, pyuria means presence of WBCs in urine. So sterile sabihin walang bacteria. Okay, sterile pyuria. Presence of WBC cast, and with no bacteria. Okay, with no bacteria. Next, for epithelial cast. So, squamous and transitional are not seen in epithelial cast. So, usually, ang only epithelial cell lang na naka-attach sa, of course, sa uh, epithelial cast natin is, of course, RTE. So, bakit kaya hindi kasama si squamous and transitional? So, if you try to remember, casts are formed at the distal convoluted tubule. So, sa mismong kidney. Okay, so saan ba nakikita tong squamous at transitional? Okay, at the lower urinary tract. Si squamous, usually nasa urethra. Si transitional, pwedeng ureter, pwedeng bladder. Okay, pwedeng sa calyces. Okay, sa ureter, bladder. Okay. So, nasa lower urinary tract na siya. Okay. So, si RTE lang naman yung present sa upper urinary tract. Okay. So, same lang siya ng clinical significance with an RTE. So, it may indicate tubular injury. Okay. So, aside from that, it may also be present in viral condition. So, drug, heavy metal, chemical induced toxicity. Okay. So, again, um, same lang siya ng reasons kung bakit siya nag-appear sa urine, same with RTE, allograft rejection, okay, as well as it may also accompany the WBC cast in pyelonephritis. Since again, pyelonephritis is a tubular or interstitial disorder. Next, we have fatty casts. So, fatty casts are seen in conjunction with oval fat bodies and free fat droplets in disorders causing lipiduria. So again, once na narinig ang lipiduria, dapat isa lang yung papasok sa isip natin, nephrotic syndrome. Okay, so again, nephrotic syndrome is characterized as having uh, abnormal excretion of protein in the urine, increased lipids in the circulation, okay, and increased lipid in the urine specimen. Okay, increased lipid in the circulation, thereby producing large amounts of lipids then in the urine. So again, for nephrotic syndrome, ano yung mga dapat nating tandaan? May presence ng fatty cast, oval fat bodies, okay, as well as markedly proteinuria. So, how will you confirm the presence of fatty cast? So, same lang siya for oval fat bodies. You need to confirm if you need to confirm the presence of a fatty cast, you need to perform fat staining as well as polarizing microscopy. So, again, for fat staining, oil red Owen Sudan 3, okay, mga i-stain mo doon, okay, yung neutral fats or triglyceride. For polarizing microscopy, polarizing microscopy naman, the main lipid detected here in polarizing microscopy is cholesterol. Okay. Next, we now move on to granular cast. So in disease states, granules may represent disintegration of cellular cast. So again, aside from that, may also be seen during periods of strenuous exercise. So again, nabanggit kanina in athletic pseudonephritis or in strenuous exercise, granular cast may also be seen together with RBC cast and hyaline cast. So granular cast, although may be seen in strenuous exercise, can also be pathologic. Okay, kasi in granular cast, it may represent disintegration of the cellular cast. Okay, usually in granular cast, it may indicate some form of urinary stasis. Okay, kasi ang trend natin for kidney disease progression is actually nagsa-start sa cellular casts. Okay, from the cellular casts, kapag nagkaroon ng urinary stasis or abnormality na hindi mo ma-excrete lahat ng urine mo, okay, from cellular, mag-disintegrate into granular. Okay? So, kapag granular, after nun, kapag may extreme urinary stasis na talaga, sobrang lala ng kidney disease, kidney condition, okay, magiging waxy na siya. So, waxy denotes extreme urinary stasis. Okay, indicative of chronic renal stage. Okay, chronic renal kidney disease. Okay. Chronic kidney disease. Okay. Next. we have yung waxy cast. So again, waxy cast is formed from the degeneration of granular cast. So kapag nagkaroon ng granular cast, it is representative of extreme urinary stasis, indicates chronic renal failure or chronic kidney disease. Okay, so indicates chronic renal failure. Okay, so waxy cast is characterized as having jagged or broken ends. So ano yung jag niyan? Okay, jagged ends or broken ends. Okay, jagged, okay, or broken ends. Next, we have broadcasts. Broadcast or renal failure cast, same sila ng significance or clinical significance ng waxy cast. They may indicate extreme urinary stasis. Okay, indicative of renal failure. Okay, so the broadening of the casts, okay, represent the widening of the tubular walls or the widening of the distal convoluted tubule. Okay, so all casts or all forms of cast may have a broad form. Okay, but the most common broad form, okay, broadcasts is the granular broadcast or the broad waxy cast. Okay, so yun yung most common, broad granular cast or the broad waxy casts. So this is an example of broad waxy cast. Okay, broad waxy cast yan. Next, we now move on to crystals. So before pa natin mag-start, okay, so crystals, in evaluation of crystals, ano yung most useful chemical test for you to identify, okay, crystals? Okay, of course, yung most useful na chemical test is yung pH natin. Yun yung gagamitin mo for differentiate, okay, para ma-identify, okay, kung ano yung crystal na yun. So, what are the normal crystals in acidic urine? So, let's start first with amorphous urate. So, amorphous urate, okay, amorphous meaning wala siyang distinct form. Okay, so amorphous urates may obscure significant sediment. Okay, since amorphous siya or walang distinct form, pwede niya obscure significant sediment. So, how will you eliminate this interference amorphous urate? Okay, you may warm the specimen. And then after warming at 60 degrees Celsius, okay, magde-dissolve na yung amorphous urate. So, isa pa sa significance ng amorphous urate, it precipitates, okay, after you refrigerated a specimen, okay, after refrigeration of specimen. So again, if you remember earlier, okay, so yung uroerythrin pigment, okay, yung magkakos ng pink coloration and then eventually magsisettle down siya, didikit siya sa amorphous urates, okay, that precipitates upon refrigeration. Okay, so amorphous urates, again, siya yung may pink coloration due to uroerythrin. Next, we have uric acid crystal. So uric acid crystals is pleomorphic, meaning it has many morphologies. So it can either be four-sided, six-sided, star-shaped, rosette, spear, plates, colorless, red, brown, or yellow. Okay, so it usually uh, uh, has many morphological variation. Okay, so usually, ito si uric acid crystals in the laboratory, we commonly misidentify it as cystine crystal. Okay, pwede natin siya ma-mistake as cystine crystal because uric acid crystal may also have a six-sided morphology. Okay, so same sila ni cystine, di ba, yung mukhang piatos. Okay, so how will you differentiate it from a cystine crystal? Okay, so uric acid polarizes light. Okay, it is birefringent. Okay, aside from that, uric acid uh, uric acid may also be differentiated from cystine by addition of HCl. Okay, so uric acid crystals insoluble in hydrochloric acid, cystine crystal soluble in hydrochloric acid. Next, we now move on to calcium oxalate. So calcium oxalate has two morphologies, okay, two forms, calcium oxalate monohydrate or what we call as wewelite. So it is described as having a dumbbell-shaped appearance and may resemble calcium carbonate or RBCs. So again, nasabi ko kanina, calcium carbonate may resemble the calcium oxalate monohydrate. So again, for you to differentiate the two, since pares sila mukhang dumbbell shape, okay, saan ka titingin? So again, yung most useful test or unang gagawin if you have difficulty in identifying crystals, okay, tingin ka sa pH. Okay, for kapag acidic yung pH, then it is calcium oxalate monohydrate. Okay, kapag alkaline yung urine, calcium carbonate yon. So aside from that, calcium oxalate monohydrate may indicate ethylene glycol poisoning or antifreeze poisoning. Take note, it may indicate ethylene glycol poisoning. Okay. Next, we have another form of calcium oxalate dihydrate or Wedelite. So ito yung classic shape niya, yung envelope shape, yung alam natin, yung most common. Aside from that, take note, calcium oxalate is the most common component of renal calculi. Okay, so again, kaya iniiwasan ng mga stone formers yung masyadong acidic kasi ito si calcium oxalate precipitates at acidic urine. Ito yung most common component ng renal stones. Okay, that's why binibigyan ng mga antacids yung mga patients na stone formers usually. Next, we have normal crystals in alkaline urine. So, amorphous phosphates, similar siya ng appearance in microscopic examination with amorphous urates, but there are two ways for you to differentiate, okay, the amorphous phosphate and amorphous urate. So, tingin ka dun sa macroscopic appearance ng crystal, okay, in the specimen. So, kapag appearance is white precipitate, then it is amorphous phosphate. So, kapag again, may pink precipitate, okay, that's amorphous urate. So, bakit ulit pink? Because there is presence of pigment uroerythrin. Okay, so ano naman yung second way for you to differentiate amorphous phosphates and amorphous urate? Okay, so of course, tingin ka sa pH. Kapag acidic, urates. Kapag alkaline, phosphates. So, just like amorphous urates, amorphous phosphates may interfere, may obscure significant, clinical significant sediment. Okay, so in order for you to eliminate this interference, you can dissolve amorphous phosphates with dilute, okay, acid, or in this case, 2% acetic acid. Okay, next. We now move on to triple phosphate. So ito yung alam na natin, having a coffin lid appearance. Usually, no clinical significance yan. But it is often seen in highly alkaline urine associated with the presence of urea-splitting organisms. Okay. Most notably, si Proteus. Okay. So usually kapag triple phosphate, it usually indicates na highly alkaline lang yung urine. Next, we now move on to ammonium biurate. Okay, so ammonium biurate is having yellow-brown and alam natin na thorny apple appearance, usually seen in old specimens. Usually, no clinical significance. Okay, no clinical significance for ammonium biurate. Next, we now move on to calcium phosphate. So it has a needle, rosette, pointing finger appearance. So the form seen in alkaline urine is the needle form. Okay, needle form lang yung nakikita in alkaline urine. This form. Okay, calcium phosphate or apatite. Next, we now move on to calcium carbonate. So again, dumbbell-shaped, it may resemble calcium oxalate monohydrate. So again, tingin sa pH, okay, for you to differentiate, okay, yung calcium carbonate at calcium oxalate monohydrate. Okay, so no clinical significance. Next, we now move on to abnormal crystals. Take note, lahat ng abnormal crystals, usually, they are present in acidic urine, but some, okay, may be present in neutral urine. Pero usually, lahat yon acidic. Okay? So, kung papiliin kayo sa dalawa, okay, for example, may dalawang sagot, choice na acidic or neutral, okay, piliin natin yung acidic. Next, first abnormal crystal, we have yung cysteine. So, cysteine is present in condition called cystinuria. Okay, so cystinuria, basically, there is a failure of the renal tubules to reabsorb cysteine. So usually naman, cysteine is a amino acid. Usually, amino acid, it is a low molecular weight protein. Since low molecular weight protein siya, readily filtered siya by the glomerulus. Okay, so since it is amino acid and it is essential for our body, ang gagawin nun, i-reabsorb siya ng kidney tubules. But if the kidney tubules fail to reabsorb the cysteine, okay, excreted siya in the urine. Okay? So, yun yung tinatawag natin na cystinuria. Okay? Cystinuria. So, again, usually naman ang amino acids nangyayari reabsorption at the proximal convoluted tubule. Okay, so cysteine, again, may resemble uric acid, specifically yung six-sided shape na uric acid. So how will you differentiate cysteine from uric acid? So cysteine does not polarize light as well as soluble sa HCl or hydrochloric acid. And take note, positive sa cyanide, nitroprusside test. Okay. Take note, positive in cyanide, nitroprusside test. Next, we now move on to cholesterol, normal crystal. So it is characterized as having flat plates with, okay, ito yung keyword natin dyan, siya yung may notched corners. So again, for cholesterol, flat plates having notched corners. So cholesterol, kanina pa natin siya nababanggit, okay, present siya in lipiduria, okay, such as in nephrotic syndrome. Okay, if you try to remember si cholesterol, again, siya yung nade-demonstrate or na-visualized by means of a polarizing microscopy. That's why it is birefringent. Okay, so ano yung pattern niya or appearance niya in polarizing microscopy? So it may resemble or it may show a Maltese cross pattern. Take note, si cholesterol siya yung may Maltese cross pattern. Next, abnormal crystal, we have bilirubin. So bilirubin are yellowish brown needles, plates, or granules. So bilirubin is seen in liver diseases. So if you see bilirubin or if you suspect bilirubin crystals in the urine, so tingnan mo yung dapat yung chemical test. Dapat positive, of course, ang bilirubin. Next, we have tyrosine. So tyrosine are fine yellow needles in sheaves or rosette. Okay, seen in severe liver diseases. Okay, same with bilirubin. Okay, and it's often conjunction. It is seen often in conjunction with leucine. Okay, so si tyrosine kakamba lagi si leucine. Okay, next, how about leucine? So leucine, yellow oily looking sphere, and take note, ito yung keyword niya, siya yung may radial and concentric striation. Okay, siya yung striation. So same siya ng clinical significance with tyrosine. It may be seen in severe liver diseases. So seen less frequently than tyrosine, rare siya as compared to tyrosine. But if nakakita ka ng leucine, dapat ka ring makakita ng tyrosine. So kapag nakakita ka ng leucine, kunwari, suspected mo leucine siya pero wala ka ng tyrosine, then it is not leucine. Okay, so dapat seen siya in conjunction with tyrosine. Next, okay, now move on to the last topic. Okay, yung other renal disorders. So for here, di ko isa-isayin lahat ng renal disorders, mga renal, tubular, interstitial, but i-emphasize ko lang yung mga usually okay, na dapat nating tandaan. Okay, as well as yung mga expected urinalysis results from that. Okay, so for acute glomerulonephritis again, okay, so it is considered as a post-streptococcal sequela, meaning it arises from the infection, with Streptococcus pyogenes or streptococcal infection. So it is considered as a complication of Streptococcus pyogenes infection. So what are the expected urinalysis results in acute glomerulonephritis? So kanina, lahat na may glomerulonephritis, dapat may proteinuria, positive for blood, RBC, and RBC cast. So again, proteinuria, RBC cast, positive blood. So specifically, of course, may notice ka na dysmorphic form or dysmorphic RBC. Next, we now move on to pyelonephritis. Pyelonephritis is under upper urinary tract infection. So yung infection nasa interstitium na or tubules. Okay, so what are the expected urinalysis results? Since the infection is already in the interstitium, of course, there will be present proteinuria. So aside from that, in the chemical test, okay, positive, of course, of LE and nitrite. Okay, LE and nitrite for pyelonephritis since it is under infection. Aside from that, ano naman sa microscopic, makaka-notice ka ng WBC cast, and bacteria. So again, WBC casts, it is most useful for the differentiation of the upper from lower UTI. And of course, upper UTI, yun yung may WBC cast. In lower UTI, yun yung walang WBC cast. So cystitis, under siya ng lower UTI. So ano yung mga expected urinalysis results niya? Okay, siya yung may positive leukocyte esterase and nitrite, WBC, and bacteria. Take note again, wala siyang WBC casts. Next, we now move on to acute interstitial nephritis, usually caused by an allergic reaction to a certain medication. So, keyword here, associated siya with allergy. Okay, allergic reaction. So, what are the expected urinalysis result? Okay, so proteinuria. So, again, interstitial to, interstitial disease, interstitium disorder. So, may presence ng proteinuria. Proteinuria, positive in LE, of course. Okay, and if positive LE, dapat makakita ka ng WBC and WBC cast. So, take note again, in acute interstitial nephritis, okay, meron tayong tinatawag na septic, rather sterile pyuria. Okay, ibig sabihin walang presence na dapat na bacteria. So, addition to that, okay, yung nabanggit natin kanina, so it may show for acute interstitial nephritis, pwede kang makakita ng eosinophil. Okay? Pwede kang makakita ng eosinophil. Okay? So again, how will you demonstrate eosinophil in the urine? Okay, by means of Hansel stain. Next, we now move on to nephrotic syndrome. Nephrotic syndrome, again, group of symptoms that is characterized by proteinuria, hyperlipidemia, and significant edema. Okay, so pamamanas. Okay, hyperlipidemia or lipiduria. So what are the expected urinalysis results? Striking or marked proteinuria, of course, positive sa protein. Okay, casts, all kind. But most notable na cast na makikita mo kay nephrotic syndrome, of course, is yung fatty cast. Okay, fatty casts. And, of course, the presence of oval fat bodies. Next. Okay, we now move on yung review questions or yung mga para review tayo for the microscopic examination. Okay, so let's start with first question. So based on the following urinalysis results, pH of 6, bilirubin negative, leukocyte esterase negative, SG, specific gravity 1.010. Okay, so hypostenuric. Okay, isosteniuric rather. Isosteniuric urine. Urobilinogen normal, nitrate positive, protein 100 gram per deciliter, blood small, microscopic 10 to 15 HPF, 25 to 30 HPF ang RTE cells, WBC 0 to 3 HPF, granular cast 2 to 5. Okay, which of the following conditions may exhibit this result? Okay, so sa unang tingin pa lang, alam mo na agad. Okay, kasi nakita mo. Okay, actually may in every case study, may dalawang approach eh. Either titingin ka sa specific result and alam mo kung ano yung keyword o yung buzzword para malaman mo kung ano yung sagot, or pwede kang mag-eliminate. Okay, so ano yung dito yung keyword na pag nakita mo, ito yung tamang sagot. Okay, so in this case, nakita mo na agad na, okay, may presence ng increased number of RTE cell. Okay, so again, greater than 2 may indicate tubular injury. Okay, so again, the answer here, of course, is acute tubular necrosis. So ano pa yung isang way? Okay, you can try to eliminate. So for glomerulonephritis, again, ano yung mga results dapat natin na makita? Okay, ang mga expected urinalysis results. Glomerulonephritis, again, proteinuria. Okay, meron naman, proteinuria. RBC, meron. But take note, wala siyang presence na RBC cast. Okay? Or wala siyang presence na RBC cast. Or wala rin nabanggit na may dysmorphic RBC. Okay? How about pyelonephritis? So again, pyelonephritis is an upper urinary tract infection. So ano ulit yung mga expected urinalysis results mo dyan? So positive sa protein. Okay, yes. Positive sa nitrite. Positive sa leukocyte esterase. So in here case negative, pero it's okay. And dapat positive sa may presence ng WBC, WBC cast, and bacteria. So in here, walang presence na WBC cast, wala rin presence ng bacteria. So automatic, excluded, or ruled out na si pyelonephritis. How about for nephrotic syndrome? Bakit hindi siya kasama? Okay, so again, ano yung mga expected urinalysis results natin dito? Marked proteinuria, okay, ito mataas. Yes. But take note, walang presence na, okay, fatty cast or iba't ibang cast. So, ang nandito lang na cast is granular cast. Okay? So, wala siyang fatty cast, walang oval fat bodies. Okay? Although in nephrotic syndrome, pwede siya magpakita ng ganitong RTE. Okay? But again, wala siyang granular cast. Wala siyang iba't ibang cast. Okay? Fatty cast. Okay? So, marami kasing cast presence, pwedeng nephrotic, pwedeng waxy, at kung ano-ano pa. Okay, next number. So, crystals associated with severe liver disease include the following except okay, so the answer here okay, is letter C. So again, bilirubin, leucine, and tyrosine are seen in liver diseases. Okay, si cysteine, saan siya nakikita? With errors of reabsorption. Okay, tubular reabsorption. Okay, disorder. So again, in cystinuria and cysteine, there is the failure of the proximal convoluted tubule to reabsorb cysteine. Okay. Next, a medical laboratory scientist seen this crystal in a routine urinalysis. This most likely indicates that the patient has, of course, this is yellow crystal. Okay, yellow pointed needles. Okay, Pointed crystals, this is a bilirubin crystal. So again, sa nakikita sa bilirubin crystal, seen in severe liver disease. So paano kapag nakita ka ng overall fat body, okay, or fatty cast, but nephrotic syndrome? Pag nakita ka ng RTE, okay, that's tubular damage.